Hello everybody and welcome back. This is Dr. Mridula here. So a simple question. Will dry eyes go away on its own? Well, nowadays we see so many people having dryness in their eyes and they find it so difficult. So the answer is very clear. Dry eyes will not go away on its own if the underlying issue, the reason why it is happening is not clearly solved, then the dryness will not go away on its own. But wait, hold on. Now, if the dryness is a very temporary phase or if it is very mild, then of course it will go on its own. By this I mean that, say you've got a dryness in your eyes if you haven't slept properly for a couple of days, or if you were too anxious, or if you haven't hydrated yourself well enough, or say you've been using the screen time, excessive, more than usual, just for the past couple of days because you just had to complete your target or something. So for the past couple of days, if you've extensively used your screen or increased screen time, or say if you've been exposed to too much of dry air, hot, humid, hot conditions, then yes, the dryness can be reduced on its own by having good amount of sleep, while hydrating yourself well, by completely shutting down or completely drastically dropping down the screen time and blinking your eyes well, or going back to a nice warm atmosphere where there's no harsh wind hitting onto your eyes. In those cases, yes, certainly the dryness can come down on its own. But however, the dryness will persist. It will not go, say if you're somebody who is above the age of 50 years or somebody who is approaching menopause, so because of the hormonal changes, or if you're someone who has extensive screen time, continuous screen time, so because of the decreased amount of blinking, the dryness will definitely persist. Also, if you have certain autoimmune conditions or the side effect of certain medications like an antihistamine, like for anti-allergy, or certain antidepressant medications can also contribute to this dryness. The take-home message is the dryness in your eyes, if it is very frequent, happens at very frequent intervals, chronic, and it is worsening, then it will not subside or resolve on its own if you don't take any treatment. This requires appropriate treatment and management and regular monitoring. Okay. But if you ignore it, then what happens is it can only worsen your condition. You're expected to have more of this eye surface damage, infections, and even your vision can also be affected. Okay, so like I said, dryness, if it's mild and temporary, it can resolve. But if not, then please do the required treatment. Take care. Thank you.